Hi, I'm Corby Banner. I'm at the offices of Dr. Willy Dayan. He's an orthodontist. I had Invisalign done because I was on TV and I wanted braces, but I didn't want anyone to know I was having the treatment done. Since I had my treatment done, there's been a lot of advancements in the technology. Today we're going to find out how.
So Invisalign is a method of moving teeth by aligners, by plastic, removable clear plastic that fits over the teeth, and it's capable of placing forces on the teeth that help the teeth move to better positions, just like braces. It is a different medium, and it does take some training and time for orthodontists to get used to the differences between braces and Invisalign, but both are very successful.
I myself chose to have Invisalign instead of traditional braces because I wanted to continue with my work on TV without anyone knowing that I actually had braces on. What other advantages are there to Invisalign?
So Invisalign, being, as you said, invisible, and therefore most people do not know that you're wearing it, but also major advantages are that you can take the aligners off when you eat, so you don't get all that food stuck between your braces. You can take your aligners off to brush your teeth, to floss your teeth, to go to the dentist. So with all the removal, the cleaning and the health of the teeth and the tissues can be so much better.
What other advantages are there to Invisalign over traditional braces?
So as you say, they are invisible, but they're also removable. And by having them removable, you can eat without them, you can clean your teeth without them, you can go to the dentist and get your teeth cleaned without them. So therefore, the health of the tissues in the teeth can be so much better.
Fantastic. Tom Cruise had them, that's why I went for it.
Okay, well then if Tom Cruise can do it, we can all do it.
How does one know if they're a candidate for regular orthodontics and whether Invisalign would work for them?
So candidacy for regular orthodontics is for all ages. You can benefit from orthodontic treatment. So you could be 7 or you could be 107. For Invisalign, you do need most of your permanent teeth, so that would start around the age of 12, which we've had many patients treat their teeth at the age or that age of 12. And then all the way up to 87, we've had patients doing Invisalign, and they're enjoying the improvement in their smile and in their bite.
Fantastic. What I like most about Invisalign is that you're keeping your natural, healthy teeth rather than the alternative, which most people that I know want a quick fix and they'll go for veneers, which are not your own teeth.
So that is a major benefit of orthodontics, and Invisalign has improved the ability of so many people in situations that they wouldn't have worn braces to now keep their natural teeth and have their smiles improved. So candidacy for Invisalign depends on a person's experience with the product. So just like anything else, people who have more experience, they see the range of Invisalign treatments increasing. So we in our practice, who use a lot of Invisalign, have treated many patients who've been told at other places that they wouldn't have been candidates, and they've finished their treatment with successful results.
How long has Invisalign been on the market, and what does the future look like for aligner orthodontics?
Invisalign's been on the market for the public since 1999, so that's about 13 or 14 years. And I know that there are many other companies bringing aligner products forward, especially aligners, and computer-generated orthodontics is going to increase tremendously over the next few years.
Please explain what computer-generated orthodontics is compared to traditional.
In traditional orthodontics, we used to straighten teeth with wires, stock wires, and put them into people's mouths to straighten their teeth. It was very mechanical. By computer-generated orthodontics, I mean that we first go on a computer with some kind of scan or image of the patient's teeth, and we kind of do the treatment virtually first, planning everything before we get to the mouth.
I was thrilled with my own results from Invisalign. I thought it was fantastic. But when I started, you used to make an impression, a mold impression of, and I understand that technology is basically on its way out.
It is. Again, computers are helping us to become more efficient, more effective for our patients, and more comfortable. So no longer do you have to have a physical impression of teeth. We now have scanners that are able to digitally scan, or if you want to think of it as take a three-dimensional picture of teeth with a special wand in the mouth, and then create a virtual model that will be a more accurate copy of your teeth than the impressions you had yourself.
Amazing. I personally didn't mind having that goopy paste in my mouth for a few minutes. I saw the end result of great teeth, but I understand some people have that as a deterrent to getting Invisalign.
Yes, in fact, some people in the past used to not get their treatment just based on that objection, and they couldn't see themselves past it. Today, they've since come back to the office, had the virtual scan, and they've straightened their teeth with good health, good bite, beautiful smile. So it has increased the accessibility of getting those results for more people in the marketplace.
As a photographer, I've encountered so many people who will not smile in their photos because they're embarrassed about their teeth. To me, Invisalign gave me a whole new lease on life because it gave me the confidence to do something that I never had done as a teenager. Can you give me any stories to illustrate that kind of thing?
Well, just the other day, Corby, we had a patient also who came in, and she was very not proud about her teeth. So not proud, she developed a habit of always talking like this or not smiling in photos. And she started Invisalign. She's still in the middle of treatment, but her boyfriend recently commented that she no longer puts her hand up when she laughs, and she laughs with her teeth out, and it's so much happier for her and for him.
Anything that gives confidence and self-esteem, I'm all for.